Hello, our presentation is on the use of the internet to facilitate evidence-based nursing practice, which is a topic that we thought was interesting due to the fact that we will be nurses soon, and this will play a major part in our nursing profession. So what is evidence-based practice? Evidence-based practice is a process by which nurses and other healthcare practitioners use the best available research, evidence, clinical expertise, and patient preferences to make clinical decisions. This is very important because as we're looking at
evidence-based practice, this is basically what governs us as nurses. It allows us to have the best research and to be able to validate our findings, as well as validate information that is already presented before us. How can we use the internet to facilitate evidence-based nursing practice? As nurses, we can use the internet as a way to research evidence-based practice. It can also be used to support the development of evidence-based practice. It is used to validate our findings, implement recommendations and guidelines, and it also gives us insight when we don't have the answer. Evidence-based practice dictates the way we practice as nurses. It is basically what governs us. The internet. The use of the internet allows us to search databases of professional journals and credible evidence-based practice websites. It significantly reduces the time and effort a person might expend investigating a clinical question. It provides us the access to credible and reliable sources. In order to provide excellent health care, we are required to have knowledge of the latest research about health conditions and their treatments. Nurses need to be active in pursuing the most current evidence to support their practice. The internet does just that. It provides easy access to and use of material to help with our practice. Information is often updated immediately, which is always a good thing because we always have the most current needed information right at our fingertips. This allows for our job to be done a little bit more easier, more effectively, and it serves as more of a time efficient tool for us.
Strategies to implement the evidence-based practice. Implementing evidence-based practice is the hardest part of the healthcare system. Some strategies in implementing evidence-based practice include: 1. Gathering as much information as possible. This includes patient history, signs and symptoms, and all pertinent medical information. Secondly, provide for research. Gather the proper resources that will help make you make the correct medical decision. Thirdly, build an evaluation plan based on the evidence and the patient's preferences in their healthcare planning. And fourthly, adapt with caution. When implementing your planning, make sure that you take it one step at a time. There are several steps in using the evidence-based practice. The first step in evidence-based practice is to frame the clinical question. When framing the clinical question, include population, intervention, comparison, and outcome, also known as PICO. The second step is finding the evidence. We as nurses must seek out evidence when preparing the treatment method. Closing the gap of evidence-based practice is important. Closing the gap of evidence-based practice begins with fully understanding the evidence. There is a difference between knowing what the evidence is and understanding it. There are several different ways to obtain evidence. First, by asking questions, including the PICO approach to gather the correct evidence to solve the problem. After getting the information needed through questioning, you must do proper research using all resources available to obtain a well-rounded plan for the patient. Taking these steps will ensure a bridge in the gap of the evidence-based practice.
The use of online journals and medical record as a way to facilitate evidence-based nursing practice. Online journal allow for nurses to learn up-to-date research. It allows for interaction between different nurses and individuals in the healthcare team. Online nursing journal clubs increase nurses' knowledge of evidence-based practice. Online medical records allow for quicker access to patient records. It increases diagnosis and treatment of patients. It decreases error with personal health records.
Evidence-based practice is defined as a problem-solving approach to the delivery of healthcare that integrates the best evidence from studies and patient care data with clinical expertise and patient preferences and values. An approach to providing care that integrates nursing experience and intuition with valid and current clinical research to achieve best outcomes.
The need for evidence-based practice. Evidence-based practice is essential to the transformation of healthcare by providing proven, effective treatments. At present, there is a gap between theory and practice that results in diminished patient care, ineffective practice, and excess time lag between discovery of knowledge and incorporation into the clinical practice. Why does evidence-based practice matter? Research shows that evidence-based practice leads to higher quality care, improved patient outcomes, reduced costs, and a greater nurse satisfaction than traditional approaches to care. Most nurses practice according to what they learn in nursing school, their experience, and what colleges share in the clinical setting. Evidence-based practice with patients. The nursing field is developing on a regular basis. New technologies and skills to access information, research, and knowledge are the basic fundamentals of evidence-based practice that can help nurses in overall care of their patients. Nurses will have a new empathy and compassion for their patients while giving them expert advice and care. Nurses now have the strongest trends in healthcare systems with evidence-based practice because it allows them to apply their evidence-based practice to research and administration to patients and their care. Evidence-based practices have become a benchmark for nurses' credibility and respect. They are beyond nurses, information leaders, and have the ability to show that through research and now patient-nurse interactions. Healthcare information technology tools. Computerized physician order entry, electronic health record, electronic medical record, personal health record, EPIC systems, nursing intervention and classification system terminology, nurse outcomes and classification system terminology. What is evidence-based practice? Evidence-based practice is the conscientious use of current best evidence in making decisions about patient care. The evidence-based practice process is a method that allows practitioners to access research, clinical guidelines and other information resources based on high-quality findings and apply the results to practice. Evidence-based practice integrates the best available evidence to guide the nursing care and improve patient outcomes. This helps healthcare practitioners address healthcare questions with an evaluative and qualitative approach. The impact of evidence-based practice. The impact of evidence-based practice has echoed across nursing practice, education, and science. The call for evidence-based practice and quality improvement in healthcare transformation underscores the need for redesigning care in effective, safe, and efficient. Evidence-based practice has stopped compulsive actions by promoting the use of research resources, which ultimately provides justifiable diagnoses and treatment, which leads to safe, effective, quality care. Internet usage and evidence-based practice. In order to practice evidence-based practice nursing, practitioners must understand the concept of research and know how to accurately evaluate this research. Professional training must have been assessed for one to be qualified. You use the variety of resources to research. With the internet right at our fingertips, it can be both easy and dangerous. You must have attained the skills to ensure that the website is a reliable source, or it's just something like a blog where you can post information. Is the data current? Is the website biased or one-sided? All of these website evaluation skills is needed before evidence-based practice can be properly used.